Hi, everybody. My name is Marie Keener, and this is my capstone project, Communication Methods in Pharmacies Qualitative Research for APC 401, Miami University. And so, pharmacies play a very critical role in patient health and patient care. For dispensing medications, pharmacists check for interactions or potential problems, as well as double checking what the doctor wrote. Pharmacists are the medication experts, and to ensure patient safety, mistakes with medications need to be caught by the pharmacy team. Communication and consultations are a critical step in ensuring the health and safety of patients. Consultations are when the pharmacist will talk to the patient, explain the medication, and see if they have any questions. To make sure this is done effectively, there are several different forms of communication that could take place, and then you just choose them depending on the situation you are in and the people you are dealing with. Style of communication can differ, but it is critical to know when to use each form. My experience. So the reason I'm doing this project is because I worked as a pharmacy technician for about 4 years now, be 4 years in July. I worked at a retail pharmacy for about 3.5 years, and then I started at a oncology private practice pharmacy in January. For my literature review, I reviewed previous research that was done on various different um, parts of communication and mainly consultations in pharmacies. In order to do this, the reading materials and health knowledge, which is all important to the patient. The past research will help to orient me in the research I am performing and be able to expand my knowledge and growth of pharmacy consultations to understand the research. One of the first topics is reading materials. Many medical documents can be very confusing and challenging for a patient to read, so it's important that they are easy to understand. Health literacy. A 2023 study examined how health literacy was taught in 7 disciplines. This was to see how students learned about health literacy, and it was found that there was no standard within these disciplines. Core communication skills were also found to be successful for teaching in a classroom and with patients in real scenarios from a 2010 study. By utilizing these teaching strategies and getting a standardized version of their teaching across disciplines, new professionals will be able to improve their skills and overall improve the care and their patients receive. Consultations. So this was the bulk of my literature review. A set of criteria was found for effective consultation, including open-ended questions that consisted of encouraging the patient to ask questions and including family members. The 2023 study reviewed that low patient interaction in pharmacy consultations. 42 different interactions were followed, and the patients would only ask about 3 questions, and the pharmacist would talk for the majority of the rest of it. Methods. So, for my research, in order to gain a greater insight and understanding into how communication works in pharmacies, gathered information from healthcare and pharmacy professionals, I can see a larger picture of the pharmacy and patient communication interaction. This way, I can find the best methods for communication in pharmacy specifically. To do this, I use qualitative research methods, utilizing surveys to get information from the participants. So, the participants consisted of 8 of my either current or past coworkers and supervisors. This was a convenient sample. Out of the 8 participants, all of them currently work in a pharmacy. 4 were pharmacists, 4 are technicians. I currently work with 5 of them, and 3 were my past coworkers. The pharmacists have a combined over 90 years of experience in the pharmacy. Technicians have over 45 years of experience in the pharmacy. Data collection. So for this, there were 14 questions in each survey, resulting in 26 double-spaced pages of the completed surveys. It took about 120 to 160 minutes for all of the participants to complete the survey. For ethical considerations, all of the participants' names were changed to their title in a random letter. So we have pharmacist A, technician D, etc. Any of the businesses or company names were changed to just their generics. We have a retail pharmacy, or we have a small business or oncology pharmacy. This way, any patient or participant wouldn't feel weird commenting on their current workplace, and they were welcome to skip any question or not participate in the research as a whole. So the first topic is communication in retail pharmacies. Retail pharmacies operate in a quick and streamlined manner. Purposes A said that there's little interaction Outside of performing the required consultations, big chains kept you too busy with production line prescription duties to allow time to get to know most patients. Technician H said that they have constant and continuous patient communication on the phones and in person. But in a retail setting, other expectations put a time limit on the allowed time to communicate with patients. In an independent or a local pharmacy, they're sometimes in doctor's offices or clinics, typically have less customers on a daily basis, and it can result in a more attentive pharmacy staff who can have time to consult patients for longer. Pharmacist A said that they have more time for patient interaction and socialization. They got to know the patients who would visit and console them, chat with them. And the downside of this is when a patient passes out is upsetting, but at least you know you made a difference. Pharmacist B said that they can take on harder questions and use their research and knowledge more effectively. So overall, the importance of communication in pharmacies was expressed expressly by all of the participants. These reasons could be life-threatening to the patients, and these reasons are as follows. Medication misuse. If a patient uses a medication incorrectly, this could have drastic effects on their health. Medication could be easily misinterpreted, sometimes just by reading the label. This is why it is so important that healthcare professionals are able to effectively communicate with the patient. Pharmacist D said, sometimes chemo meds need to be taken without food, or too much of the drug gets into the bloodstream, heightening the side effects and not helping the cancer. This is why they have to communicate with the patients. Risks and side effects. Risks can be a possibility with any medication a person may take and can increase when you're taking lots of medications and higher risk drugs like chemotherapy. It's important that the pharmacists are there to tell the patients what to look out for when taking these medications so any minor side effects can be addressed. Pharmacist C said without proper communication, patients will not know what they are taking, why they are taking it, or the risks associated with it, and what will happen if they take it incorrectly or stop it. Drug interactions. Interactions could occur where it becomes dangerous to the patient or renders the medication ineffective. This could happen with other medications or even food or alcohol. So this is important that the patient or the pharmacist communicates this to the patient. Pharmacist A says there is also different drug interactions that can occur with chemotherapy and supportive medications. It's important that patients are aware of these so that they are not given a drug by another physician that could cause a serious interaction. Communication styles. So there's several styles of communication that continues the bulk of the rest of the survey. And so we just compared pros and cons for each of them. Verbal communication is used of spoken words between two people. For the pros, pharmacist A said that the interaction between patients providing comfort, letting them know you care, and allowing them to easily opportunity to ask any questions or concerns. Pharmacist C said you can assess patient understanding in real time and have them relay information back to you to check for gaps in understanding. The cons, technician H says it can be very frustrating to try to explain things to people. Pharmacist C said many people aren't proficient in English, so you have to repeat things many times, and sometimes the patients can't hear very well. Written communication consists of written words on paper specifically. The pros for pharmacist D said information is presented in its entirety and can be referred to as often as needed. The cons, technician E said that written medical jargon can be complex for a patient to interpret. Visual communication is specifically for diagrams and charts for this research. Pros is pharmacist A said that some patients can better understand with visual examples versus somebody just describing it to them. And the cons, pharmacist C said that pictures and diagrams, sometimes you have to have an understanding already of the topic that you're talking about without just looking at a picture. So sometimes it can be harder for the patient to understand. So the most effective form of communication, two participants said a combination of verbal and written. Three said just verbal. One said it depends on the patient. Two said a combination of all of the forms. So it appears that most of the participants believe that verbal communication should be the primary communication form, followed by other forms, specifically written, and then depending on the patient, the medication, and the circumstances, how the rest of it should go. So based on these surveys conducted, it's clear that communication is imperative in pharmacies. There are so many factors going into medication, so many small things could be easily messed up. A mix of all forms of communication is a key to providing excellent care and proper communication in the pharmacy. Just one method might be enough for a patient to understand initially, but the addition of another method can lead to better results. Conclusion, Communication is incredibly important in the medical field and is very important when dealing with medication and each patient's health. Communication should start with spoken words and then move on to others. So the technician would ask questions, ask if they have any questions, transfer them over to the pharmacist who can provide a consultation. Then they would give them medication guides or other printouts if needed. Ideally, these would come in a very simple language and possibly other languages as well. This way, anybody can understand it. They could also provide videos if needed. Utilizing all of these communication skills will provide the patient with the most knowledge in the most effective way, improving their health literacy and the effectiveness of their medication. And these are my references. Thank you so much for watching. I hope you guys have a great day.